I'm checking my orders, gathering my supplies. Yeah. I'm washing my hands. Knock, knock. I'm providing privacy. Hello, my name is Caitlin, and I'm going to be your nurse today. Can I just have your name and date of birth?
Bree Deal, 2/17/94.
Okay, perfect, Bree. I'm just going to do a quick assessment on you. Do you have any questions before we get started?
No.
Okay, I'm going to raise her bed up. And I've already checked her vital signs. They are normal. Bree, are you having any pain?
Yes.
Can you... Okay. Can you rate your pain on a scale of 0 to 10?
I would say about a 5.
Okay, and what's an acceptable level of pain for you?
I would say a 5.
A 5? Okay.
So I'm fine.
Okay. Bree is obviously alert and oriented. She's answering my questions. So we're going to go ahead and get started, Bree. I'm just looking at her head and looking at her overall appearance. She's well groomed and dressed. She's clean. Her head is symmetrical to her body. I'm looking at her ears, and there's nothing.
No drainage.
No drainage in her ears. They're symmetrical. She can hear me just fine. I'm going to be looking at her eyes. Bree, can you follow my finger?
Mm-hmm.
And she's able to watch this and come down. And her eyes are, pupils are equal and round and reactive. So I'm also looking at her nose. She's not having any nasal flaring. She's not having any drainage. Bree, can you stick out your tongue for me? Her tongue is pink and moist. Her mouth has no lesions. And now I'm just going to palpate your throat, okay, Bree? Her trachea is midline. She doesn't have any JVD. So we'll be moving down, and I'm going to listen to you for a second. I can hear S1, S2. And her apical pulse, I don't hear any murmurs. Perfect. So now I'm just going to go ahead and check all her pulses. Okay, perfect. I'm also inspecting her skin as I do this, and she doesn't have any bruises or lesions. And I'm going to go ahead and feel her joints. Now I'm just going to look at her capillary refill. Perfect. And I'll also check this in her toes as well. And she has no edema in her legs, and her collar is perfect all over. So now, Bree, I'm just going to listen to your lungs. Her lungs are clear. She's not struggling to breathe or using accessory muscles. Can you sit up for me, Bree? And I'll also be listening to her back. This is the same way. Her lungs are clear. And I'll also just go ahead and check your back. Can you tell me if you have any pain? Flank pain?
I remembered. No pain.
Okay. You can go ahead and lay back down. So now I'm going to take another listen to her stomach, and I'll go ahead and listen in all 4 quadrants. I can hear active bowel sounds in all 4. And then I'm just going to go ahead and feel her stomach is not distended, and I don't feel any lumps. Okay, perfect. so now we're just gonna look at some ranges of motion. Bree, can you go ahead and point your toes towards yourself and then out? And then can you grab my hands? She has great grip strength. And can you lift your arms up and down? And then can you stand up for me? And touch your toes. Okay. You can take a seat. And I'm just gonna look one more time at your fingers. And can you put them together for me like this? Perfect. No clubbing of the fingers. Alrighty, and I'm just gonna lower your bed back down. You can lay. Is there anything that you need?
Just a glass of water.
Okay, I will be right back with that. I'm gonna clean up here, wash my hands, and I'm gonna go document.